My name is Atsushi Suzuki. I'm a professor in medicine in Fujita Health University in Japan. I'm a member of the Asian Pacific Consortium of Osteoporosis. Japan currently has 120 million people, and we are now in the super aging society. The population-based estimate of osteoporosis patients is 15 million in Japan, although the number of the inhabitants in Japan is decreasing. The concept of osteoporosis is rather new in medicine, so we need more enlightenment and education to the people about osteoporosis in order to prevent and reduce osteoporotic fracture. In 2018, the annual incidence of hip fracture is estimated at 190,000. And this number is expected to increase to 300,000 in 2040. The direct cost of each hip fracture is estimated at $28,000 in Japan. And the number of hip fracture in 2050 is 1.5 times higher than in 2018. Epidemiological data suggests that the number of vertebral fracture is 10 times higher than hip fracture, 1 to 1.5 million per year in Japan. The rate of pharmaceutical treatment is still low in Japan. Even after the clinical fracture under 50% in 1 year. We found that in winter, 70% patients who have vitamin deficiency in Japan. The vitamin deficiency will affect the efficacy of anti-osteoporotic agents, so it's a very big problem for the better treatment to prevent the osteoporotic fracture. According to the IOF best practice maps, there are 9 gold, 70 silver, and 11 bronze rating hospitals in Japan. However, the many hospitals in Japan have not yet applied to the best practice of IOF map. Now we have the 3,600 liaison service coordinators in Japan. Very many people would like to join to this activity. Unfortunately, the fracture liaison service, including the secondary prevention, is not reimbursed by the health insurance. In the future, we need some economic support for the people in the liaison service team to continue to this kind of activities in Japan. The objective of the FLS is to prevent the secondary fracture after the first fracture. However, for the OLS activities, the target people is not only the patients, but also the general population. Education is very important to prevent osteoporosis and support the osteoporotic patients at home or in town. In 2011, the Japan Osteoporosis Society launched the program for osteoporosis liaison service. This includes primary prevention and secondary prevention of osteoporotic fracture. We have the 50% of nurses and 50% of other healthcare professionals in this program because we have many aspects of the medicine in this activity. The exercise, nutrition, and the daily health care. The Asia-Pacific Consortium on Osteoporosis, APCO, comprises key medical opinion leaders from several Asian-Pacific countries, developing the solutions for the big challenges about fracture prevention and osteoporosis management. APCO's mission is to engage with the stakeholders, including policymakers, healthcare providers, and the public to develop the regional and country-specific program for the osteoporosis management and the prevention of osteoporotic fracture and the complication with the fragility fracture in Asian-Pacific region. APCO developed a new framework for screening, diagnosis, and management of osteoporosis in Pan-Asian Pacific regions. This framework will support us to develop the newer, updated guidelines in a country. Now we are preparing the new guidelines for the prevention and the treatment of osteoporosis in Japan. It's a joint mission of the Japan Osteoporosis Society, Japan Osteoporosis Foundation, and Japanese Society of Bone and Mineral Research. And during this preparation process, we can refer to this APCO framework, and we can check the international standards. I believe that this framework can contribute to our daily management and treatment in osteoporosis. To learn more about APCO and APCO Framework, please go to apcobonehealth.org.